Hey guys, this is Dr. Celaya. Hope you're doing well. You know, there sure are a lot of people with allergies. I see them all the time. And there's so many different reasons why you could have allergies. Anything from histamine reactions to foods to inhalants. But you know, have you ever thought that it could be lack of stomach acid? I know it sounds weird, but let's think about this. So your stomach acid is meant to not only digest food, but also to sterilize everything that gets in your digestive system. You know, stomach acid is hugely underestimated as far as with allergies, and a lack of stomach acid can cause heartburn. I know that sounds counterintuitive, but it's true. You know, stomach acid, what it does is it helps digest proteins and other foods, but it also helps control the valves that make it so your body doesn't necessarily reflux acid up into your esophagus. It also controls valves through the rest of the system. It also helps by stimulating your pancreatic enzymes and also the secretion of bile, which helps digest fats. So it's important to make sure you have the adequate amount of stomach acid. And if you don't, what happens is instead of digesting the protein into smaller amino acid sequences, your sequences may be too big. And those amino acid sequences, once they're absorbed by the body, can look a lot like your body tissue and therefore create immune responses. You know, your stomach acid is anywhere from 1 to 3. That's enough to take the chrome off of an old bumper of a car. But very, very often we end up with a problem where we don't have enough stomach acid. People tend to think when they're dealing with heartburn or GERD that they're having too much stomach acid, and exactly opposite is true. You're not having enough stomach acid to cause the valves to work to stop whatever you do have from sloshing into your esophagus. So it's just really important to make sure that stomach acid is appropriate, and therefore we may cause a reduction in allergies. So symptoms of low stomach acid can be heartburn or GERD, indigestion, burping and belching after meals. I'm sure you've had that or have seen somebody that's had that. Bloating and cramping, gas within an hour of eating. You can have constipation or diarrhea, and lots of food sensitivities. When I see somebody coming in that has allergy testing and they've got everything under the sun wrong with them, I know we probably have a stomach acid issue or even a leaky gut issue or a combination of both. Undigested food and stools, chronic fatigue, acne, or even eczema. Dry skin or hair because you're not necessarily getting the nutrients. And if you're not breaking apart your food, you're not going to get the nutrients to even build stomach acid. And so it's kind of like a big vicious cycle. You have weak or cracked nails. You can have asthma on top of allergies, and even osteoporosis here again because you're not getting the nutrients. There are a lot of reasons you can have low stomach acid as well, and one of them is genetics. There's about a 31% of these low acid issues can be a genetic component. You have Barrett's esophagus, you have adenocarcinoma, that can be part of them. A bad diet can be part of it. So if you're not consuming the right foods, you're not going to get the building blocks to even make stomach acid. Age, either young or very old. Well, maybe not very old, but 50 plus. You know, when you're young, you may not have either the ability to produce a stomach acid, you may not have the right diet to be producing the right stomach acid, and people that are over 50 can have issues with producing stomach acid. Those cells that produce stomach acid also produce intrinsic factor, which makes it so you absorb vitamin B12, so you can have a B12 deficiency as well, which can lead to anemia and a whole host of other conditions. A low salt diet, sodium chloride, Cl. It has the common thread, hydrochloric acid. Antibiotic use can reduce stomach acid as well. Antacids, you know, usually you may not necessarily start off with having low stomach acid, but you take an antacid for some little bit of a reflux condition, and therefore you may develop a serious low stomach acid problem and therefore have esophageal reflux. A gastric bypass, and one of the other ones are low B vitamins. In fact, B3 can create a low stomach acid also. There's a lot more. So if you have an allergy issue, you may want to consider looking at your stomach acid. But you have to understand, it's not just as simple as taking just an HCl pill. There's a lot more to it. And usually when we're dealing with a patient, we have them go through a process to taking that digestive enzyme, because it's not simple. You have to go through it, and you've got to get to a point where you see if it's causing you issues, and therefore we start to increase the dosages appropriately. And there's certain reasons you do and certain reasons you don't want to do it. I hope this helps.